In this video lecture, we'll review the pharmacological treatment options for our various anxiety disorders. We'll start by talking about anxiolytics. Anxiolytic is another way of saying anti-anxiety medications, and the most common class of anxiolytic medications are the benzodiazepines. These include drugs like Xanax and Valium, and they work by increasing GABA levels in the brain. So remember, GABA is our universal inhibitory neurotransmitter. These benzodiazepines have a number of advantages. So one is that individuals respond to them very quickly. So many of them have an onset within 15 to 30 minutes of taking the medication. They result in a very drastic and noticeable decrease in symptoms of anxiety. So because of this very rapid, clear anxiolytic effect, patients tend to have a strong preference for benzodiazepines. So they find them very effective and they experience a really effective reduction in their symptoms of anxiety. However, the benzodiazepines have some really significant downsides. So one disadvantage of the benzodiazepines is that they have a very high risk for abuse and dependence. Individuals tend to develop a tolerance to benzodiazepines over time. They can require higher and higher levels of doses. This can lead to problems with treatment over time, and over time this can actually increase an individual's anxiety and also put individuals at risk for developing symptoms of withdrawal when they try to stop using their benzodiazepines. There are also concerns with the use of benzodiazepines because they do have a risk for abuse for use as recreational or street drugs. So for example, individuals may sell their drugs or use them for non-prescribed purposes. From a treatment standpoint, however, another big concern with the use of benzodiazepines is that long-term, these medications can actually inhibit the efficacy of psychotherapy and long-term result in increases in anxiety, even though in the short term they're very effective for reducing the symptoms of anxiety. Benzodiazepines can make psychotherapy for anxiety disorders less effective, and they can do this in a few different ways. So one is that they can affect some of the psychological processes that are related to the efficacy of our treatments for anxiety disorders. So for example, if in cognitive therapy for panic disorder, you are helping challenge a patient's beliefs that physical symptoms of anxiety are dangerous, if you are prescribing medication that is designed to get rid of these physical symptoms very quickly, you are really reinforcing that belief that those symptoms are dangerous. So on one hand, you are trying in cognitive therapy to help challenge the inaccurate belief that these symptoms are dangerous and are something to be avoided, so that can maintain some of these symptoms of anxiety. Benzodiazepines can also interfere with psychotherapy at a neurological level. So one thing that benzodiazepines do is interfere with the process of long-term potentiation. Long-term potentiation is the process through which changes happen in neurons in the brain, through which learning occurs. And many of our psychotherapy options for anxiety disorders are built on learning principles. So for example, helping extinguish conditioned responses or helping change conditioned associations. And long-term potentiation is the process that makes those learning processes happen. So because benzodiazepines interfere with long-term potentiation, they can actually prevent at a physical level an individual from experiencing the changes in their brain that would lead those experiences in psychotherapy to result in long-term changes to their anxiety and their behavior. So even though patients really prefer the very rapid and drastic reduction in symptoms of anxiety that the benzodiazepines produce, when we are thinking about effective treatments long-term for anxiety disorders, as opposed to being able to relieve someone's symptoms of anxiety very quickly, the benzodiazepines are not our best treatment option. A class of medications that are much more effective for treating anxiety disorders are our antidepressant medications. And this includes all of the categories of antidepressants that we discussed for our depressive disorders. So the primary drugs that tend to be used as first-line treatments are our SSRIs and sometimes our SNRIs. Monoamine oxidase inhibitors and tricyclic antidepressants can also have anxiolytic effects. So some of the advantages of antidepressant medications are they have a lower risk for abuse or dependence. Patients are less likely to develop tolerance and require much higher doses over time. They also have a lower risk of being abused and being used for non-prescribed reasons. And not only do antidepressant medications not interfere with the efficacy of psychotherapy, there's some evidence that they may actually facilitate the efficacy of psychotherapy for anxiety disorders. So some individuals may be better able to engage in psychotherapy for anxiety if they are on antidepressant medication. The primary disadvantage of antidepressant medications is the length of time that it takes for these medications to have an effect. So just like we see with the use of antidepressant medications for treating major depressive disorder, it can take up to 4 weeks for these medications to reach their full therapeutic effect. So for an individual who's experiencing symptoms of anxiety, this long wait period, particularly if they start experiencing side effects before they start experiencing the mood and anxiety benefits of their antidepressant medication, can be really frustrating. So many patients prefer the short-acting efficacy of the benzodiazepines over these antidepressant medications, but despite the fact that they take longer to take effect, they are much more effective in the long term for treating the symptoms of our anxiety disorders. We'll finish by talking about a specific pharmacological treatment for the performance-only subtype of social anxiety disorder. And this involves the use of beta blockers. So beta blockers are not primarily prescribed as psychiatric medications. Beta blockers are often prescribed for blood pressure problems, but a side effect of beta blockers is that they can reduce some of the physiological symptoms of performance anxiety. So for example, when individuals experience trembling or shakiness, beta blockers can reduce these physical side effects. So they are sometimes prescribed as a short-term treatment that individuals can take before performance situations to help manage some of those physical symptoms, which then helps reduce the anxiety that they experience in those performance situations. And one group of individuals that beta blockers have particularly been widely used with are musicians. So as you can imagine, if you are a musician or if you are a singer, some of those physiological symptoms of anxiety might be particularly distressing. So for example, if you play a string instrument, if your fingers are shaking, that is going to affect the sound of your instrument. Or if you are singing and you feel like you're trembling, it might affect the quality of your voice. So these beta blockers have been used, for example, by musicians or singers. They will take them before a performance. They are short acting and also have a short half-life and can help manage those physical symptoms. So here are findings from a very early study of the use of beta blockers for treating performance-only social anxiety. This was a study of 29 musicians. This was a randomized controlled trial. And here we are seeing a comparison between a group that received a placebo and a group that received a beta blocker before giving a musical performance. You can see that the blood pressure of the group that received the beta blocker was slightly lower than that of the group that received the placebo. That difference was not significant. When we look at the pulse, so the heart rate of the individuals who received the beta blocker, that was significantly lower than individuals who received the placebo. And when we look at their self-reported symptoms of anxiety, those self-reported symptoms were also lower. So one way that beta blockers appear to work is that by reducing the physical symptoms of anxiety that individuals are experiencing, it interrupts the cognitive process where they become anxious about those symptoms and become concerned about negative evaluation, and that leads to increases in anxiety, which results in worse physical symptoms.